This is a Global News special presentation.
Welcome and Happy New Year. 2020 has been a year like none other. Now behind us, but this interview done in the spirit of 2020. I'm wearing dress shoes for only the second time since March, mostly due to Premier John Horgan on election night and now today, and we are distanced. We have done a number of these, but this time we are more than 6 feet apart. Happy New Year. Thank you so much for doing this.
Happy New Year to you, Richard, and your family, and all those watching at home.
So let's look back at 2020. And one of the major issues linked to the pandemic has been long-term care homes. Did the government do enough to protect the vulnerable citizens of British Columbia who live in long-term care?
Certainly, we had significant challenges when COVID hit us in February and March of 2020. We immediately took steps to close the border because we knew that the virus was coming from overseas, it was coming from Europe, it was coming from Asia, it was coming from the United States. And then we saw significant outbreaks in care homes across the province, but particularly in the Lower Mainland. The consequence of that was we had healthcare providers, care aides mostly, that were working in 1, 2, and sometimes 3 facilities to make ends meet. Decisions by previous governments to reduce wages in that sector meant that in order to feed families, people had to be in multiple places. That meant that the disease was transmitting from one care home to another by staff. People in care homes weren't moving around, the staff were. So we brought in a single site policy which saw a decline in outbreaks in long-term care, and then we took immediate steps to add more staff. We're going to continue doing that, not just now, but as we see the end of the pandemic, but right through the next year and a year after that to create a better environment for our elders.
You fixed that issue, and then in October and November and December, once again, we saw climbing deaths in long-term care. Was enough done? Should rapid testing have been at least one of the layers used to help prevent those deaths in care?
Well, I take my advice from Dr. Henry and her team. Her view is that rapid testing is not accurate enough to be helpful at this point in time. When those tests get better, as all of the technologies have over the past number of months, we'll implement those. So we're not holding back for any reason of financial. It's because the tests are not as accurate as people want them to be. So I take my advice not from the internet, but from Dr. Henry. She's telling me that this is not the time to implement the rapid testing in long-term care facilities because it just will lead to more false positives, that will lead to more confusion, staff staying home, and a whole bunch of other issues that people don't think through when they say, well, wouldn't this just be the easiest thing to do? So I'll take my advice from Dr. Henry on that.
In December, you described our response as successful. Do you think that resonates with those who have had loved ones who have died in long-term care, or that look at the numbers and we see deaths continue to climb and cases continue to climb through November and into the beginning of December?
The second wave has been profound on all of us. We shut down significant portions of our economy. As you know, at the start of the pandemic, we had the best results in the country. As a result of that, people worked together. But we've seen tragically heading towards 700 people have lost their lives as a result of COVID-19. And many of them in long-term care facilities. The challenge we had as the second wave hit is that we had more interactions in the economy. The more people are interacting, the more likelihood of spread of the virus. That meant the virus was getting back into long-term care through staff, through no fault of their own. This is not, people don't catch a cold or contract a virus because they want to. It's a virus. And so we were hit hard, as have other jurisdictions, but we've taken steps to remediate that, and I believe that our healthcare providers, the heroes, the true heroes in this situation, are doing their level best to keep people safe, and we'll continue to do that as we start with vaccines for those long-term care providers, and then as we get new vaccines that are easier to manipulate, to move around, we'll get our long-term care patients and residents vaccinated as well.
The province's goal at the beginning was to encourage British Columbians to follow the rules, and I know you got a lot of questions. Why not more significant fines? Why not more significant fines? And eventually, in November and December, the province got to more significant fines. Do you regret not doing that sooner?
Well, I think you need to do things when you do them. And I know that sounds glib to people watching at home, but we had extraordinary pickup from the general population. to the advice and the direction of Dr. Henry. Our communities were responding way better than other provinces to asking people to use their common sense. As the second wave hit and we had more interactions in the economy, more virus spread in communities, we needed to bring in stricter guidelines. We needed to bring in harsher penalties. I believe that British Columbians may well be saying you should have done that sooner. But what we don't want is scofflaws, people ignoring the laws, which may well have happened had we brought them in the summer when case counts were very, very low. People would have dismissed the regulations. Now that we see the results, increased deaths and increased transmission, people are responding. And those who are not, this is a life and death situation. We're not playing around here. This is serious business. We've brought in enforcement mechanisms, more people to enforce those rules, and I think that the timing was the timing, and I stand by that.
Your party has often found allies in teachers. Do you feel that you've put teachers in situations that have been anxiety-ridden, undue risk associated with the back-to-school plan, and do you feel that they feel abandoned by your government?
Well, I certainly hope that's not how they feel. I do absolutely understand how teachers, other workers in the K-12 system, parents are anxious. We're in a pandemic here, but the evidence is overwhelming that the best place for kids to be is in a school setting for their emotional well-being, for their education outcomes. So the challenges we have is that we need to all work together. And our plan involved teachers, it involved education assistants, janitors, administrators, everybody talking about how can we best get kids back into classrooms. And there's been anxiety and there's been stresses and there have been outbreaks. But we're doing our best to make sure that we minimize that. And I think the vast majority of parents, although they may well be anxious, also know and understand that the best place for their kids to be is in a classroom.
One of the things that was promised by Dr. Henry and your government was more accountability around exposure alerts, and we're sitting here in the winter break and we didn't have that. So why did we not get that accountability that people had been promised?
Well, one of the challenges with contact tracing is you want people to be honest with you when you ask them who they've talked to, who they've interacted with, so we can trace where the virus is going. If we start to stigmatize people and condemn them for contracting a virus, they're less likely to come forward and say, this is where I was, these are the people I interacted with, and our ability to contain outbreaks is reduced. We don't want to stigmatize people because they get sick. We want to help them, and we want to make sure that we minimize the spread. So we've been talking in the school setting, we've been talking to the individuals that have potential to have contracted the virus, and that's been comprehensive right across the province. We have a school-by-school plan that's been developed by teachers, administrators, trustees, all of the stakeholders, parents as well, to make sure that we're as on the cutting edge of where we need to be to protect people. Do we need to amend that as new information comes forward? Absolutely. But I think the vast majority of British Columbians understand that every day we're learning a little bit more about how we can be better. And we're going to continue doing that until we get to the back end of COVID-19.
All right, so now let's take a quick break. And when we get back from the break, let's have a conversation around what we're looking at for 2021 and the next steps from the provincial government. That coming up after the break. Welcome back. One of the other pinnacle moments of 2020 was the election, and now the NDP has that majority government they crave. So, Premier John Horgan, what can you now do with that majority, that mandate that you were unable to do while governing a minority situation with the Greens?
Well, I certainly grappled with the decision to call an election. As it turned out, we were able to have an election safely. There were no impacts from the campaign on the broader public, and we were able to renew the legislature, not just with New Democrat MLAs, but new Liberal MLAs as well. Some 30 new people who were not in the legislature last year are going to be in the legislature this year. That means new eyes, a new generation of legislators to take us forward into 2021 and beyond. And I'm very, very pleased that the politics is behind us and we can all focus on people and the services and the programs that they need.
But what can you do that you weren't able to do before the election?
If we were still in a pre-election period, every decision would have been cloaked in, oh, this is a political choice that the government's making, and the opposition would have condemned the action, whether they supported it or not. That's politics. I felt we needed to put the politics behind us so that we could bring the best people that the community wants to send to Victoria 87 communities around BC with representatives that should be focusing on them, not on politics. So we put that behind us. Now we can focus on improving our outcomes with respect to the economic recovery. We can put our energies into revitalizing our long-term care capacity without it being cloaked in the, oh, that's just a political decision. We want to make the right decisions for British Columbians. We can do that now with a stable government focused on people rather than on politics.
Through the campaign, cases of the virus were going up. Right at the end of the campaign, we started to see those record-breaking numbers, especially out of Fraser Health. If you had waited, everyone would have been vaccinated. Are there any regrets around pushing to an election that ended up being the lowest voter turnout in the province's history?
Not at all, and I think if you look, there were more votes in this past election than any election except the one we had in 2017. And the voter turnout was about the same as it was in 2009, 0.5% off the last time we had a profound crisis, the economic meltdown. So I'm not at all concerned about that. What I am concerned, and I also want to put to rest this notion that public health was at risk. Dr. Henry has complete autonomy, as does public health officers around BC, to act when they need to act. And we left the province in good hands. We conducted a campaign. We asked British Columbians who they wanted to represent them, and they sent 87 people to Victoria. And now the task at hand is the most important: focus on rebuilding our economy and protecting people as we get through COVID.
And of that group of 87, you have named a number of them into your cabinet. One of the big themes of 2020 as well was diversity. Is your cabinet diverse enough? 8 visible minorities, it's gender balanced, but the most visible positions, yourself, the health minister, the minister of energy, the attorney general, they are white men. Do you feel you've done enough for diversity in your inner circle?
Absolutely. I'm over the moon about the diversity of the legislature today, as opposed to what it was when I was first elected back in 2005. My cabinet is gender balanced, an Indigenous woman, South Asian women, South Asian men, Chinese Canadian candidates are at the table. The caucus is diverse, the discussions are robust. We've got millennials, we've got seniors, and everything in between. I'm very excited about the diversity that we're putting in front of British Columbians, because now they're seeing themselves reflected. Wherever they may come from, whatever their background is, they're seeing themselves reflected in their government.
In the spirit of 2020, let's do a redo from the debate. So I'm going to read to you a question that many people criticized your response to on debate night during the campaign, and I'll ask you again. How have you personally reckoned with your own privilege and unconscious bias as a white political leader?
I have been doing that every day before the debate night and since the debate night. I don't believe that questions of that magnitude can be answered in 30 seconds, and I'm not going to do it justice on this program today. What I do know is that systemic racism needs to be talked about all the time, at kitchen tables, in lunchrooms, wherever people gather. We need to grapple with the diversity that we have around us and make sure we do better every day. We're going to bring forward we have brought forward the Human Rights Commissioner, reviving that position after the Liberals did away with it. Raj Chauhan is the Speaker of the Legislature, the first South Asian to sit in that chair and preside over the legislature that he couldn't have come into as a member in the 1940s, and now he presides over it. We've done a lot as a society, and I'm not bringing glory to the NDP here. We've done a lot as a society to address systemic racism, but we have a long, long way to go. My job as a white 250-pound dude is to do my best to make sure that we're doing what we can to include everybody in the decisions that we make and grapple with the systemic challenges. Things like reviewing the Police Act, which we've got underway, bringing in anti-racism legislation, which we'll be doing in the spring session. All of those issues have to be not just on a debate stage, but every day, and that's my commitment.
The pandemic has battered the provincial economy, although there has been a bounce back near the tail end of 2020. What is your vision for helping right the economic ship in British Columbia? Well,
we were in a really good shape in February of 2020 when we tabled another balanced budget. We had the lowest unemployment rate in the country. We had the most robust growth of any province in the land, AAA credit rating. We were, in fact, the fiscal envy of the country. and then COVID hit and knocked the daylights out of all of us, wherever we lived in Canada. We're in a good place as we go into 2021. We've seen positive indicators, whether it's increased revenues, whether it's jobless rates going down, our credit rating remains intact. So I'm confident that we can continue to build on the successes that we've had in British Columbia up to the beginning of the pandemic and going through it by making sure we get dollars into the hands of individuals, businesses and communities so that the communities particularly can deliver the services that people depend on so their businesses can thrive.
There will be businesses that will never reopen again that are now closed. Are you worried that you didn't move fast enough to provide that support or rely too heavily on the federal government to help keep these businesses afloat?
Well, we work very collaboratively with the federal government, and I'm very pleased with that. I give full credit to premiers across the country, a diverse group of people, conservatives, liberals, and me, the New Democrat, sitting down, putting aside all of those political differences we may have, and focusing on the people of Canada. I'm very proud of the work that we did as a unit of premiers working with the Prime Minister. With respect to the speed with which we acted, there was no point in stimulating the economy when we were telling people to stay home. So we needed to have the timing right on the flowing of dollars into the hands of businesses. No point in giving money to a business that's not going to be able to make it because they were in a tough spot before the pandemic. So we needed to make sure that we were doing as much as we could for those that were going to survive. That sounds very harsh, but this has been a harsh time, not just for British Columbians, but for Canadians and indeed the global economy.
And to use your word, it's been harsh on many around their own mental health, from young
Absolutely.
people to older people. Is your government willing to roll mental health treatments into the MSP system?
Well, we've been doing that incrementally since 2017, and we have a lot more to do. Having the first standalone Minister of Mental Health and Addictions put us in a good place. We see provinces doing that now right across the land. Mental health has been taxed significantly over the past 12 months. I go back to the question about getting kids back into school. We wanted to make sure that kids understood that they could go to a safe place, they could learn, they could socialize with their peers. That helped the mental health of youngsters. That eased the mental health challenges for families. But we have a long way to go. This has been the most challenging of times, unprecedented in our lifetimes, and it'll take some time to get through this. And that means making sure that government has resources in place so that our public health care system can help people when they need that help.
We're going to take one more break. In our final segment, we'll have Premier Horgan reflect back on some more of those decisions and then speak to some of the things that he continues to hope to accomplish. That coming up after the break. Welcome back. Many people look back at 2020 and think, what could they have done differently? So I pose that question to Premier John Horgan. Any of the decisions you made for the province in 2020 you regret and wish to take back?
Well, we can always, in hindsight, look at choices that we've made as individuals or as a government, in my case, and say maybe we should have done that a little bit differently. I'm proud of a lot of the accomplishments we had coming up to the pandemic, the Clean BC plan on climate action, leading the country in that regard, the UN Declaration on the Rights of Indigenous Peoples, which for once puts to rest the notion of rights and title in British Columbia so that we can have an economy that includes everyone. Those choices were positive choices. When the pandemic hit, it was a daily challenge to decide which way do we go. I'm very grateful for the advice of Dr. Henry and her team. I'm very grateful for my friend Adrian Dix, an extraordinary individual who helped us get to a place where we were confident that we were making the right choices for people. Did we make errors along the way? Of course we did. I'm not going to inventory those, Richard. I'm sure that's the comment section. We'll take care of that. But we're not without fault, absolutely. I fully acknowledge that. But I prefer, as an optimist, to look at the successes that we had as a community, and I'm gonna go with that into 2021 and do my best to improve on the places where we made mistakes and continue to build on the successes that we've had.
Like, what keeps you up at night? Like, what do you think about in terms of your day-to-day job that just continue to linger that you struggle with?
I think of 5 million people who now more than ever look to governments. Many British Columbians, as you know, didn't give a second thought to their governments until COVID hit. And then all of a sudden, the most important thing in our life was our public health care system. I think the good news about that is that we can now make the investments in long-term care, make the investments in people by bringing on more staff, training more nurses, training more care aides, training more people to deliver services to their neighbors and to people in the community. That's what government's all about. That's why I got involved in it in the first place.
I've known you for a while now. How do you think John Horgan, the person, is different now at the start of 2021 than you were at the start of 2020 and what we've gone through over this last year?
I'm older, I'm heavier, I have less hair, but I'm not any less optimistic. What I've seen in 2020 is extraordinary generosity and kindness from British Columbians who saw that we were collectively in a place that none of us have ever been before. Were there bad actors? Absolutely, but the overwhelming majority of people came together. I think of 7 o'clock banging pots at the end of my driveway with my neighbors and knowing that neighbors around British Columbia were doing the same things to acknowledge our heroes, the grocery store attendants, the people working in healthcare, the truck drivers that were bringing food to our grocery stores so that we can continue to get through this. The sense of community that the pandemic created is something that I hope we all carry with us into 2021 and in the years ahead. Together, there's nothing we can't do.
In March, you made it very clear Dr. Bonnie Henry was leading this response, coupled with Health Minister Adrian Dix. At what point do you take the reins back and say this is now about political decision-making and guiding us towards a recovery?
Well, that's always been my job. My approach is to surround myself with the best people I possibly can and then give them the latitude to do their jobs. I've been very fortunate to have quality people around me that know that I'm giving them responsibility and they've taken that responsibility. Adrian's the most obvious example, but I could go through a dozen other cabinet ministers and staff, professional public servants that have stepped up to do extraordinary things. And that's been my style in my life, is to try and get the best out of people. And I believe that's my role as the leader of the government, is not to be in the camera frame every time. It's not to be there patting myself on the back or running away when there's a problem, but to be there to ensure that the team is functioning as best as it can for the people of BC. That's the beginning and the middle and the end for me.
Is there any decision you made that you wish you had made sooner?
In hindsight, suspending elective surgeries, there wasn't the surge that we had anticipated in our acute care system. So we could have potentially relieved some pain for British Columbians a little bit earlier. But the story there had a happy ending because the system, whether they're operating room nurses, surgeons, administrators, admissions clerks at the hospitals, making sure that we were able to pick up the slack on those elective surgeries and get those dispatched quickly and then make more progress. So even though I felt maybe we should have waited a bit longer on that moment, we were able to make up for it because of the extraordinary work in the healthcare system.
You mentioned you're getting older. We now know there's going to be an election in 2024. Have you run your last election as NDP leader?
Well, I'm going to keep doing this until the people tell me that they don't want to have me around anymore. I'm pretty excited about the challenges ahead. I'm optimistic that British Columbians want to pull together, and I'm going to continue to listen to them and take guidance from them. Richard, Ellie didn't mention it this morning when I came to work, what she wanted me to do, but we'll have those conversations closer to 2024.
I finish our conversation on a comment. One of the things you did not accomplish this year is get rid of the seasonal time changes. And one comment was, how could you possibly give us one more hour of 2020 by not making that change? But hopefully we'll see that change next year. Happy holidays. Happy New Year. Thank you for doing this.
To you too, Richard, and to everybody at home.
This has been a special presentation from Global News.